Okay, all right, perfect. So we are talking about coaching versus change work versus therapy. And there's a lot of different ways this conversation can go. Since this topic resonated quite a bit, I want to ask questions and perhaps direct the conversation or some of the tangents. But I know me personally, I blur the lines quite often, right? And a lot of that actually is like I get so many clients who either have gone to a therapist, and by the way, like full disclaimer, if that's what I say, I very much believe in therapy. So this is not a knock at all on therapy. It might be a knock on perhaps the individual specific therapist that they went to, right? Perhaps I've never met them, so I don't know. But anyways, as I was saying, I get a lot of clients who have gone to therapy, years of it, and it did nothing for them. Or I've also had clients say, I'm on the wait list and I can't see anyone for like a year or 6
especially
months
with
at
insurance.
best. Exactly, right? And you know, I live in Canada, so you know, maybe that changes things a bit. And where people live, maybe the story is different. I don't know. I hear,
No, I've heard that in the US too with
yeah, and I hear
insurance
that
that
from a lot of
people,
our friends over in the UK. It's
yeah,
kind of like a crap show over there as well.
especially since COVID.
Yeah.
Yeah.
So I do blur the lines quite often, and I think a lot of the techniques that the three of us practice are very applicable, if not sometimes even more applicable. Like you know, you have the fast phobia cure slash the rewind technique for a phobia, whereas the mainstream answer, if you go to a psychiatrist, is something pharmaceutical, and that to me just makes absolutely no sense. Um, but at the same time, I think one of the tangents I want our conversation to go to is where people who have the excellent training and skills that we have, also the area that we have no business covering, right? Because you know how many times in some of our Facebook groups, it's like, can I use hypnosis to cure schizophrenia? Right. And you know, kudos for the person asking that question because thank God they're asking. But what's scary is when people start saying yes. And that's really where, you know, I want to have this conversation. Okay, what's the difference, of course, between coaching, change work, and therapy? But where should we really be playing, and where is it okay to blur the lines? So that's the intro of my ramble.
That's
Yeah.
pretty
Yeah.
good.
Well,
That's the wrap. I think we just cut and we're done. No, that's a good question. I didn't mean to cut you off, Duff. I'm sorry.
no,
Yeah,
go ahead.
David, go ahead.
Aside from my dumb joke, I forgot what I was going to say. I think it's a mixed bag because I think
hear your joke now.
What's that?
I kind of want to hear your joke now.
It's not. It's the moment's gone.
All right, go.
But it's sort of there's a lot of crossover, right? I'll give you my definition and how I kind of look at it. I don't personally do anything if someone has a diagnosis. I don't do anything without a doctor's referral, and then it kind of depends what it is. Like if it's schizophrenia, I wouldn't touch schizophrenia unless it's stabilized and you had like a trained therapist, psychologist, someone like telling you this person's stable. So I think schizophrenia and any kind of like diagnostic disorder, it kind of runs the gamut, right? Like, are they actively in a psychotic state, or are they stabilized and they want to, they want it for what? To quit smoking, or to, like, I'm hearing voices and seeing visions and I want you to fix me, cure me. Those are different, different diagnoses, those different fields entirely. Yeah. But I tend to think that therapy is if someone has a diagnostic condition and you do therapy, you have a license and you're qualified to do that. So again, someone who is bipolar and they're actively psychotic, and it's you and the patient, and no one's on the sidelines, like kind of guiding the larger treatment. No, that sounds like a bad idea. If it's someone who doesn't have a diagnostic condition, or you're working with, or they do, and you're working with someone, and you're all on the same page, and it's a complementary modality, that can work great. I'm not touching that without like a trained, licensed person saying this is okay. You're not going to mess up my patient.
Right.
So I think that's therapy for me. Coaching, I think change work is like it's work we do, and coaching is kind of, you go into the strategy, and typically it's hypnosis or NLP, maybe EMDR or EFT or some other modality, core transformation or wholeness work are NLP based modalities. I would say, hopefully kind of Ray doesn't like crucify me for saying it, putting that box, but
putting that under change work.
Yeah, I think that's a coaching. Those are techniques that go in the coaching route. You could actually use as a therapist too, but for someone like me who doesn't have a license, I'm going in as a coach. What do you want to change? What's the strategy? If you have anything diagnostic, we're getting a referral first, and then it is like a coaching thing where we kind of look at what do you want, what are your resources, what are the strategies, and I kind of think, well, what techniques, what approach best works for this person, and it's like a very fluid thing. So that's in a nutshell. I don't want to take up too much of our time with that, but
yeah, I basically agree with you, David. But yeah, the way I think of it, the difference here, and I am just a coach in the state of Colorado, which does have a distinction, and hypnotherapy fits into psychotherapy now, and there's different regulations about it. But the way I think about it is, are you diagnosing and treating mental illness? Then you got to be a licensed mental health professional of some kind, a counselor or a social worker or a psychiatrist and so on. And, I'm not even qualified to tell you if you have one and you need to go to a therapist. Like, that would itself be practicing, something I'm not qualified for. So what I tell people is I do not diagnose and treat mental illness. That's way outside of my realm of expertise. If you feel like you need that, then look into that. I can't tell you if you even need that. I can't tell you to stop taking a medication or start taking a medication. Any of these things are outside of my wheelhouse. That said, even if someone's, they say, working with a therapist and they also want to come to see me to work on something else, I'm open to that as long as the therapist is open to that and the client's open to that, right? Like, that's fine with me. Some therapists do not want that. They're like, no, you can only work with me. Like, okay. I say, why not have a team with different perspectives? But that's fine if that's what they want to do, and then the client is okay with that. I personally would say the client gets to make the decision, not the therapist. But that's my opinion. It's similar to, like, in the medical field, you have medical doctors. They can do a lot of things. They can prescribe drugs. They can refer you to other doctors and specialists and so on. Then you have physical therapists who aren't quite like medical doctors, sort of like professionals in the medical community, but they can't like prescribe exactly the same. But they can do things like give you a treatment plan for an injury or something like that. But they can also just do massage. There's a lot of physical therapists who just do manual therapy, which is massage. And then there's massage therapists. Of course, massage therapists can do manual therapy, but they can't prescribe drugs or give you a diagnosis or even necessarily prescribe exercises. They can say, you might try these exercises, but I don't know. And they can't really tell you what exercises are going to work for you. It's a similar thing. Like, coaches, to me, we can do a lot, but everything we can do, a therapist could legally do. Like, they could just, learn all the techniques we do and do them in therapy. But they often don't because they have a different education. And their education starts with, learning a lot about the classifications that people go into with the DSM-5 or ICD-10 or whatever it is in the international community. Like really figuring out what diagnosis to give, because that's an essential part of being a therapist in at least the United States and many places, because you got to give them a code in order for the insurance company to pay for it, and so on. Yeah. And so if you can't do that, you can't do your job. Whereas coaches can't take insurance, so we don't have to deal with that. But pros and cons. Whereas change work, I think, change work's actually like it's the how-to. Like, how do we actually get in there and make the change we want to make? Now, anybody can do that. A psychiatrist could learn NLP and just do NLP all the time. But the average psychiatrist in the United States spends 15 minutes with the client and primarily manages medications. So there's like institutional pressure to do certain things that I think coaches often don't have because we're not really in an institution. So we have more freedom to try to actually solve the problem without the bureaucracy. And that's not to say there aren't great therapists within systems who are helping people on a daily basis. I think there are. And there's this institutional pressure to do things in a particular way that's very problem focused, that's very focused on the diagnostic criteria, that maybe doesn't even educate people in change work, but maybe just teaches them, some basic rapport, some basic like emotional intelligence skills. Those are good, and everybody needs those. So it's not that those are bad things, but there's just so much more we could do. Just being aware of your emotions, that's like step one. But that's not enough to necessarily change them. Usually we need like step-by-step processes that really, actually integrate resources with problem states and so on. So yeah, that would be my first take on it.
Yeah, no, and I basically mirror and agree with both of you guys. What I'll say next is why I find myself, at least, getting involved in those sort of gray areas is because, like even the example, Duff, that you gave about there could be like medical doctors who, they have a certain way of thinking, and then you have like physiotherapists, right? Well, I've been having some mobility issues, and I've tried a lot of stuff over the last, few years now. And I was going to a physiotherapist, and this guy basically just kept on giving me infrared light and said this is going to help. And, and it didn't, right? So there's that. So even in like our industry, I mean, sometimes there is incompetence, right? But the thing with the therapeutic model, and again, I'm speaking in generalizations. There's we have friends that are by career and by profession medical professionals and therapists, and they're wonderful. So again, I'm speaking in generalizations. But the mainstream today generalization of therapy is very symptom driven, right? It's treating the symptom because, and maybe that's a byproduct of only having 15 minutes, right? Or as one of my teachers used to say, it's like paying for a friend. And I've had so many of my clients say to me that they have spent all this money and all this time, and even if it was covered by insurance, here, not all therapy is, right? So a lot of it is actually out of pocket, even though our healthcare is free, or it's not free, the amount of taxes we pay, but that's a totally different conversation. Yeah. All it was sort of like a venting session. And it's like, well, how do you feel about that? Oh, let's go deeper. Let's talk about it. And it's so focused on what's wrong with them. And that's where I find that, yes, there are absolutely people who need a pharmaceutical intervention. There's absolutely people that need a psychologist, that need a therapist, but there's a vast overlap where people go to therapy because they've got real life stuff happening in their life, and the therapist actually amplifies it, as opposed to having sometimes the wisdom, I don't know what to call it, to dig deeper and kind of actually give them a strategy so that they can get themselves out and kind of be with them along for that ride. And I mean, this is where my gripe is, why I think, why obviously I love what I do and why we absolutely need to exist. And, to your point, when you said there's nothing stopping a psychologist or a registered psychotherapist or a social worker or a counselor to learning these I kind of wish they actually would, because then, a lot more people will get access to it because of insurance, right? But they don't.
Definitely.
Right?
Yeah, some do. In the Andreas NLP trainings that we put on, Many people who've come to those trainings are therapists, social workers, reverends, these sorts of people helpers. But even they are, they'll. I've talked to a lot of these people, and they're like, well, one of the things they say first is finally something I can do with my clients, which is kind of cool.
Yeah,
Exactly.
right.
Like saying, Mohammed,
And that's such a statement. It's like, well, what were you kind of doing? What were you doing before then?
Yeah, well, that's not necessarily like a statement about the therapist. It's a statement about the educational system
Yes,
that they were
exactly.
led through, which did not give them tools to do things. And then the other thing they say, though, is, they want to bring this out to more people in their profession, but there's just like, again, all sort of institutional bureaucracy or habit going in a particular direction that's actually not going towards change work. It's doing something else. It's labeling people, categorizing symptoms, putting people into boxes, and then listening with empathy. I think that's a good thing. That's like a foundational thing. You wouldn't want to do the opposite, just ignore the client, fall asleep. Like, I've actually heard people say that their therapist fell asleep when they were in the session with them.
I had someone tell me after our first session, I'm trying to remember the exact words, but it's like, this is really good. And I'm like, okay, awesome. Well, out of curiosity, what was really good about it? It's like, this kind of sounds sad, but you actually looked at me the whole time. Whereas the therapist I was, going to the entire like 1 hour or 50-minute session, because it's 50 minutes to the minute, right? It was just,
Yeah, but you got to think about like, how does somebody get there? Like, they weren't, somebody who goes to school to become a counselor or therapist doesn't start out there. They got burned out.
They do.
And why do they get burned out? Because they don't have the tools. They don't actually have the change work stuff. When you're actually seeing people change right before your eyes over and over again, you're like, wow, this is really inspiring and exciting. If you're just seeing people talk about their traumas and you're getting vicariously traumatized and you feel like there's nothing you can do about it because you don't have the tools even to work on yourself, let alone help them, then you get burned out. Eventually you're the therapist who goes, yeah, whatever.
Yeah. Someone made a comment like that on a post recently I put, but more on the physical side. And I was sort of saying that, doctors will be so quick to prescribe drugs and they don't even try like natural lifestyle stuff. But yeah, it's a valid point. A lot of these doctors have probably started out saying, all you need to do is move around, drink water, exercise, get outside, and
nobody would do it, right?
Yeah.
I have a bit of a side note to that, because I know someone who's going to work for his whatever the LCSW is in his state. Like, it's a licensed clinical social worker type degree.
Mm-hmm.
Anyway, so he said basically that first of all, you have to get what's covered by insurance. So a lot of that is when I worked at a medical library, I had to like research things to get insurance companies to pay for things. And in their defense, if you could find enough evidence to back up a modality, they would actually pay for it. Often, not all the time, but often they would. And if I couldn't, well, they'll go with what's more proven. So I can't fault them for that entirely. But I do think they have to have something that has some efficacy and they can demonstrate that. So like cupping was popular back because Michael Phelps did it in the Olympics. And I was asked, well, does this work? And I looked for articles. I couldn't find anything, more or less. Acupressure, I could. Certain therapies, I could. So also, they have to do 15 minutes. So if they're looking at their computer, it's probably not to be rude. It's probably, we have to get these notes in, because after I get done with this, another patient's coming in to fill that seat. So I can take notes while I work with you and then just renew your prescription, or I can stay another 4 hours afterwards and like fill the stuff out from memory. So I think there probably is a high burnout rate. I don't doubt that. I think it's also to survive. Like, you have X amount of time. They want these notes done and entered to insurance companies, the end, get it done. So in some regards, if you're not in private practice and you're working for a company, that agency might make you do that, or else you're looking for another job.
Yeah,
so I think
these are the kinds of
almost like it's an
pressures.
institutional problem. It's the environment, not so much. And I hear that. I mean, here in Canada, doctors get paid, I think it's like $20 or $30 per visit, right? And so with the leases they have, and like and especially young doctors who just finished their residency, a lot of them are coming off with, I think, like 200 or $250,000 in debt of student loan debt, right?
Yeah, that's
so they gotta pack in a lot of people in order for that $25 to add up.
Yeah,
exactly.
Yeah.
Exactly. Yeah. So you've got all these pressures that form in the institution. Like I used to have a wonderful primary care physician who exactly would not keep eye contact with me because she was filling out the paperwork. She would try really hard. I could tell she really cared. She would be like looking at me and typing and like, and she, and she knew she had to get to the next person after me. And she was one of the nice ones, like who really cared. So I get it. That's why, in some ways it's not personal. It's not that these are, like all therapists and psychiatrists are bad people or something like that. I don't think that's true at all. I think they're primarily good people with good intentions who go into this field to want to help and make a living. And then, there's just endless bureaucracy you got to deal with and paperwork, insurance, and yada, yada, yada. And that puts this pressure to do more conservative things. Like it has to be proven already. You can't experiment and do wild, new, creative things with every client because insurance won't cover wild creativity. They cover cognitive behavioral therapy, or whatever is proven. But the funny thing is now everything is considered cognitive behavioral therapy. Originally, it was like this very precise thing that was like challenging, distorted thinking, and then like going out and doing like these things that were kind of maybe anxiety producing and like boldly doing them. And that's the cognitive and the behavioral. And over time, because it was very effective, everybody started calling what they do cognitive behavioral therapy. So it sort of grew into this mush that now CBT just means anything you do as a therapist, which is funny because now the efficacy of cognitive behavioral therapy in studies is also lower, probably because it just involves anything and everything.
That makes sense because I was wondering, I mean, it had a great start, but now a lot of people that I'm not one that reads, gets into the research like you did, David, for example. For me, it's just what are my clients telling me, right? And yes,
and there might be other reasons why it's going down in efficacy. It might be just that people are used to it or something, and like somehow more defended against it psychologically. I don't know. It's quite possible. But one of the things I noticed is like, basically everybody thinks everything is cognitive behavioral therapy, which in a sense you can kind of make the argument, well, you're working with the mind, you're working with behaviors, isn't it the same? It's like,
that's like saying
even though it has a completely different philosophical underpinning and different techniques.
But that's like saying if you move at all, you're doing exercise. Well, I mean,
exactly.
There's still exercise that's been shown to work in programs and stuff where like you do it and like see zero results. I mean, that's why I found myself kind of defending the medical system in it to an extent that, well, they're not going to let you like do stuff that you can't show it works and have people like pay money for it. So I think that's where I think there is an opportunity to like improve and let the research kind of grow. And I think it has actually. With NLP, you're not seeing much, but you have seen recently the rewind techniques had like a randomized control trial. I think you've both seen that. Yeah. Core transformations had several studies. RTM, reconsolidation of traumatic memories. They've done trials with that stuff and have a ton of science backing their stuff up. Yep. Don't be surprised if that starts getting more push to be included under insurance and to be used in therapeutic, change modalities, because they can show, well, this does work. And it works better than a lot of the other stuff out there.
Yeah, I think that's great. I do think more research on the stuff that we think and know works from clinical experience, right? Actually proving to other people that it works is helpful to get that, more accessibility for the things that are working. And at the same time, like maybe it's just my character as a rebel, but man, I would hate to have to figure out in advance what I'm going to do with a client and stick to it in the session. I used to try to do that. I used to like plan sessions out, be like, oh, this person's coming in with this. I'm going to try this technique and that. And then because, in NLP and hypnosis, we're trained to actually respond to the person in front of me. I'd start talking with them and I'd be like, oh, that's not the structure of the problem. It's this other thing. And I'd go off script and go in this other direction. And now I'd say 99% of my client sessions are off script. I have no idea what I'm going to do before I get into the session. And I just, improvise.
I just want to, I want to just catch or rather highlight something that you said, Duff, because I think that is one of the crux or pivotal differences between what we do, and we'll probably categorize on the change work as opposed to therapy, is, you use the language, well, wait a second, that's not the structure of the problem, right? And so for us, our approach is very much that while they're not doing it on purpose and they're not doing it consciously, but they are the ones creating the problem, right? Like the issue that they have, they are somehow creating it, right? And they realize it. And so that's for us to sort of figure that out. Whereas I find therapy assumes the symptom is the problem, and they just like, oh, we need to manage the symptom, right? And they don't work at this level at all about, oh, okay, well, how is this being created? Right. And that to me is change work. It has nothing to do with coaching either. And I do want to talk about coaching as well, but let's finish this up. Therapy doesn't, at least from what I've seen, doesn't seem to focus on that at all. They assume that the symptom is the problem, and the person has it for, they have to treat it basically. But I'm open to learn more, because I that could be my own bias as well.
I think there's room in any, even like your doctor who you see, like let's say I had asthma, I have asthma and I want to go get my inhaler or whatever they have for it. Well, they might still have like a room to include certain things like certain breathing exercises, or look at environmental factors or things. So I think there is a linear progression where you could just do, right, you have X condition, give you Y medication, and follow this protocol. But I've seen doctors kind of change it up. Like when I did the grand rounds for cancer, I forget what they call it, but they talk about like cases and, people with breast cancer and cancer, and here's what the research says, here's what this other article says, based on these factors and their blood count and whatever, what's the best course of action? And there was some room to maneuver. Like there were like protocols in place, but there was still some flexibility. I think that you could be as dogmatic or as creative within the rules of whatever your scope of practice is. I mean, if you're a doctor and you're like, I think you should go home and meditate and stop using any medications, well, that may not work. But I think there is room to like look at the structure of things and what are underlying causes and what are all the factors we can look at. And I think good doctors will look at that. They'll look at, here's some exercise to try to move, like when I had a shoulder injury, well, there's some medications, but like see this physical therapist, do these stretches, go through this protocol, you'll see how the next 6 weeks go. So I think there are people that do what I would say more, I don't say better, but more creative, so I think there is room for improvisation. But I think that coaches tend to be more of the, here's our bag of techniques, here's our body of knowledge, what best fits you and how you're doing this problem and how you can get better at not doing that or doing something different. That was kind of a rant, so my apologies.
Yeah, I know, I agree.
I think within every field, even those who are under oppressive bureaucracy, there's going to be people within the system who can somehow pull it off, and then there's people who like me can't even deal with paperwork and would never fit within the system. But yeah, it's interesting. Like, in terms of what actually works, I think we, when we get to the structure of the problem, when we're willing to be creative and flexible and try different things, and there's this idea in NLP called the tote loop test, operate, test, exit, which comes from this old book, Plans and the Structure of Human Behavior, or something like that, from like the 1920s, or I don't remember when. But the tote loop is basically trying things, getting feedback, trying something else, getting feedback. So you test. You say, you think of this problem. How does it feel? That's a sort of classic one in NLP if you're trying to change how you feel. So it feels bad. Okay, well, let's do something to try to change that. But we do something in like 5 minutes. We don't do something in like 6 years, And then we test again. Okay, how does it feel now? Oh, it's still a little bit bad. Okay, try this. And we're like running these fast loops to learn. I think this is actually why NLP is better than other things. We have lots of techniques, But even something as simple as like EFT, which you're like tapping, or, you have the tote loop. You're like, how does it feel when you think about this memory? 10 out of 10 bad. Okay, tap in this sequence. You're like, what the hell is this tapping thing? I don't know if it does anything energetically to your chakras or whatever, but it distracts you for a second, and then you check back in. You're like, oh, it's an 8 out of 10. So at least it has like a rapid feedback loop where you can try new things. Whereas sometimes there's no feedback loop at all in some of these other ways of working, or the feedback loop just takes so long. Like even with SSRIs, one of the most common medications that psychiatrists give out for depression, anxiety, it takes 6 weeks before you get any feedback, before you really know if anything's working or not. That's a long ass time to get a feedback loop going. And the first one you do probably doesn't work that well. Often people have to try 3, 4, 5 different medications before they get on something that they're like, oh, this feels pretty good. This is working, and I can handle the symptoms. So that could be like a year or 2 before you feel like you found something that's really working for you. Whereas, in NLP with the kind of techniques we're doing that loop like 12, 20, 30 times, in little micro ways. You say something and you notice this, their face goes, okay, that didn't work, right? And you say something else and they go, ah, okay, that worked. And so we're doing these like really fast calibration loops, just because that's how we're trained in NLP. Now, I think that's the basis of why it works so much better than other stuff. Even hypnotists, like some hypnotists, put someone to trance, give their 30-minute hypnosis thing, bring them out and say, it's going to work great, and send them off to the world. Haven't asked for any feedback the whole time. No loop. There's no feedback. That's okay sometimes, but you don't get any feedback to the next session. If you even do a second session, some hypnotists don't do follow-up sessions. So to me, it's not even whether you're a coach or a hypnotist or, it's like, are you doing these rapid loops of actually testing things to see if they work and getting feedback as fast as possible? Yeah. Because the more of those you can do, the more you can be like, whoa, that doesn't work. Let's go in this entirely different direction. So that doesn't really matter. It's not like finding the right technique. It's learning from what you're actually doing and testing and seeing what's working.
And all of this, by the way, is, for those listening, will fall under change work.
Yes, 100%.
Yeah, this is all change work. It's not therapy, and I wouldn't necessarily call this under coaching as well, although some might get into semantics and say change work is a type of coaching, but I think I very much do believe I would love for change work to be like a word that people know. Like it seems like the only people that know change work is change workers. All right. But
yeah, specifically people who've done NLP, but sometimes other modalities too.
Yeah, exactly. And that's the thing, because like for me, like coaching, I think, okay, before I start talking about coaching, David, did you want to add anything on change work or anything on Duff's?
Yeah, 2 quick points. One, I think I learned this stuff all at the same time. I think of coaching as like, for me, the only coaching I do is change work. So I never really, in my mind, those two really did not exist as like separate entities. So it's interesting hearing you explain it, because it never would have occurred to me, just because that's how I was.
And I'll tell you why as soon as you're done. Yeah.
The other point I was going to make with Duff's is I think with therapy and coaching and change work, there are different framings. So therapy, typically you go to see a therapist for years. You don't go to a therapist like, I'm going to have like 2 sessions and I'll get done with this problem. Whereas hypnotists, you might go for like one session. Usually a 3 to 5 is like the magic number for most programs that I've seen, depends on what it is. Or a long-term, you have long-term clients, but that's more like a personal evolution sort of thing. Usually you go to a hypnotist because they're fast. You go to have a cool experience often. You go for like a short number of sessions usually, and the change is done. You don't typically see hypnotists or change workers or NLPers for like 6 months. A therapist, you might see a therapist for like 6 years, and that's normal. That's kind of expected in a lot of regards.
Yeah, and I think there are some things that are good for doing therapy for 6 years. Often you don't get changes. Sometimes people do, and sometimes people don't. But I think often what people get from long-term therapy, why do they keep going? Because they actually do need someone to talk to. They don't, like, I'm surrounded by people who will listen to me empathetically and care deeply about what I have to say. But actually, that's extremely rare. there's a lot of people who have 0 people in their entire life who would listen to them for more than 10 seconds before interrupting with their own story or some bad advice or something else. That is the norm. That people do not have another human being they can just talk to and have them listen for an hour or 50 minutes.
Cats.
Yeah.
No,
Right?
and
Cats
that's
and
actually
dogs
the
are
reason
great.
why so many people have, there's, a lot of the issues that exist.
Right.
It is because of
Or somebody they can talk to won't judge them for having those issues. Or someone who will teach them just that they have emotions and that there's names for those emotions. Like these are such basic things that it's easy to feel like, oh, like why would anyone pay for that when they can just talk with any of their 60 friends who will do that? But that's I don't have 60 friends who will do that, but I've got enough that I could call up lots of people and they would just listen to me talk. So
A lot of people give bad advice though too.
yes.
Like I have 60 friends who give like terrible advice.
Exactly, right? So if you got 60 friends who give, even if you have any friends, by middle age most men have no close friends, by the way.
really.
Yeah, zero close friends that they feel like they could call up and ask something for. But and women tend to have a few more, but not very many.
I kind of want to dig on this a bit.
Yeah, I know. And I think it's because people don't have good communication skills or emotional intelligence, especially men, because of masculine norms of suppressing emotions or only having anger as the only emotion, or these sorts of things. But I grew up autistic without knowing it, and went to a therapist in college who said, I went in depressed, and she said, "You're not depressed. You just need to learn communication skills." That was a total reframe. I was depressed, but it was a great reframe. And she handed
Yeah.
me a book on communication skills. And I'm like, you can learn to communicate better? What is this? This is crazy. And I got obsessed with it. And I tried to get my girlfriend at the time to use I statements and stuff. She was not interested at all. We ended up breaking up. But I was like, I statements. This could resolve our problems. I feel this. She's like, no, you're like that. But but yeah, communication skills. I got obsessed with them when I was 20 years old, and I've been obsessed with them for 24 years. And emotional intelligence, because nobody could tell me how to deal with all my complex feelings, being really sensitive and autistic. And so I got obsessed with how could I actually change this stuff, and I did, and it worked. And lo and behold, being able to manage your emotions and communicating well, really good for relationships. Which is not to say that all my relationships are amazing, but a lot of them are quite good. And so now I have people I can talk to, and they'll listen to me, and I can listen to them, and so on. But not everybody gets obsessed with emotional regulation techniques and communication techniques and tries to get better and better at those obsessively for 25 years. So by the time people are middle-aged, they're just stressed out, and they have pushed everyone out of their life, and they don't know why. And then they go to a therapist, and the therapist listens to them for 50 minutes. That's worth every penny. Just having another human to listen to.
I have, there are studies out there that have shown, I've only seen like the abstracts, so I won't go into too much detail, but basically that one of the most important things in any therapeutic relationship is that relationship. Like a lot of it's effective because you have someone you can relate to, and that is like a big contributing factor. Yeah. Not sure that like makes it go any faster, but it seems like it's an important piece of that whole.
It seems like an essential.
I think that's assumed, right? And that's why, like I've heard some physicians and stuff, they tell me about how they've actually gotten in trouble from bureaucracy because they were getting too close. And for me, it's like, if I don't get close, then I know I know I'm not going to be effective.
Right.
Yeah. Sorry, I'm still caught up on this whole middle-aged men don't have any close friends because I don't know.
Look it up. It's insane.
Yeah, I mean, but I kind of feel like it's an epiphany because, like, I'm starting to run through, like, my list of clients, people that I know, family members that I have, and stuff like that, and I'm starting to notice, like, I guess you're right. And I know I'm fortunate in the sense that in my young 20s, I did form a very close friends group, and there's including me, there's 5 of us, where as I like to say to them, I know I can come over and just let down my hair. Right? Yeah, it's
That's
interesting.
awesome.
Yeah.
Yeah, and that that's related to all sorts of other breakdowns in community and less religious adherence and all sorts of things that have happened in the last 20 to 40 years. Fewer social clubs. Like there's this book called Bowling Alone. I've actually never read it, but part of the premise is there used to be all these like social clubs, like bowling clubs and even things like the Masons and these sorts of things that people would attend all the time. And that attendance just went way down over the past like 50 years to where like, it's hard to find anything like that anymore. Now, I think some of it's kind of creeping back up, especially in big cities. But it is kind of a fascinating social phenomenon. So in any case, getting back to therapy and coaching, therapists often are just like rent a friend, like listen, I don't know that that's like good therapy or good for the therapist even. But if there is a need for that, ideally we'd redesign society so there's more clubs and people will just have more friends, and then we could actually do some deeper inner work because we need that too.
I'll say something from my personal experience. It is definitely not good for the therapist, because what happened to me at one point, and this was during lockdown and COVID, I guess the part of me that would get its box ticked when I hang out with my friends, and socializing and having fun and being there, was getting checked by the clients that I was working with. But then I was always surrounded by like very obviously serious conversations. Right. And so I didn't feel the need to socialize or to get out or to go out. But I did notice myself just really feeling down. Right.
Okay.
So it's definitely not good.
And I think there's this whole thing around therapist burnout. It's actually a big issue. Doctor burnout too, but therapist burnout. And I think it's because of lack of change. You're not actually seeing the change in the other human being. Whereas if you like facilitate something like core transformation, and you see the other person change before your eyes and get into a beautiful spiritual state, and you're going with them, because that's what we do in hypnosis, like you're experiencing that too. Mm-hmm. So by the end, you're in a state of beingness and love and connection. They are too. And it's like, okay, that was a wonderful experience. Can't believe I got paid for that. Amazing.
Sure, but now I'm not going out with my friends, and
There could be that too. Yeah,
like that's the thing, right?
I still want to go out with my friends after doing a core transformation session, but I get it. So change work, I think, actually in some ways is the solution to therapist burnout. Is like if you can actually help someone to change, or coaching burnout. Anyone can burn out. Like I have so much fun with my clients. It's like 10 out of 10 or 9 out of 10. But that's not true of every coach or hypnotist or NLP either. Like I know a lot of us, us coaches and stuff, and some of my friends who do this thing are kind of burned out, and they're like, "Oh, I saw this client this week. It was really hard," and I've been there too in the past, so I get it. But often it's because you can't figure out how to help that person yet. It's like this really difficult, frustrating client, and I want to help them, but I can't. So now I'm really sad and frustrated.
I've had an interesting thing, at least to me it's interesting. Hopefully some of the rest of you find it, but where I don't get bummed about clients because this is maybe I'll steal a phrase from Bob Burns, where it's like you're the positive pessimist, where the world is not necessarily the most wonderful place in the world, in the universe. Like there are a lot of things in the world that aren't great. I mean, you turn on the news.
Right, well, the world's being run by pathological people, so there's that.
You say like it's a bad thing, Mohammed. No, there are pathological people running the world. There's war, there's sickness, there's all kinds of bad things. And that's going to be there whether I do anything about it or not. If I go play Xbox for 3 hours tonight, or if I go help 3 clients, the world's still going to be the world's still going to be shit in some regards. Nothing I do is going to make everything better, unfortunately. With that being said, if I can help people, if I can make a dent in that, then I feel like I'm doing something worthwhile.
Yeah.
So no matter what trauma someone brings to me, or even if they just want just to lose 5 pounds or just to feel better on their in-laws or whatever, I'm able to do something positive. There's a real chance I can make a positive difference in the world. Not everyone can do that, mind you. We have the tools to do it, and we get to do it as part of our jobs. So I found that, for some reason, that frame sunk in, and I found that, for me, very, very positive, because no matter how much we change or don't today, I stick to work on making you and the world better and making a difference out in the world. So no matter how terrible things might be, I know I'm doing something, where if I did nothing, well, that would still be shit, and that wouldn't change. I have a chance to actually help you and then make some difference in the world and start some, enough of us get out there and help people and actually make a change. We can actually make a difference.
Yeah.
So that's why I never got burnt out.
I love it. That's a great attitude. Yeah. I've actually, in some ways, the funny thing is I just expressed that it's all about change. But I've actually changed my criteria for what a successful coaching session is, because it used to be a successful coaching session is we got the change. But that's great, except the problem is that doesn't always happen. Even with the best tools, even with years and years of experience doing this stuff. So then it feels like that's a failure, the terrible session. And then I'm a failure, and I suck as a coach, right? Like, and I used to go there a lot, and I see that in other people who do hypnosis and LP. And now it's more like a successful session is when I'm embodying the principles of change, which I call the 8 principles of the progress paradigm, and I'm writing about in my book. But if I'm embodying the principles of change, that was a successful session. So if I'm seeing things as possible for the client to change, if I'm, seeing that they have a choice in the situation, that they're not stuck, if I'm taking in the good and seeing their strengths and drawing out their strengths and resources, if I'm helping them to transform failure into feedback and be kind to themselves, these sorts of things. If I'm doing that, then I've done my job as a coach. Yay, me. Because that's what coaching is. It's not I make you change. I'm not who's that? McKenna in the UK. I will make you thin. I will make you rich. The titles of his books. That's not coaching to me. That's authoritarian control at best. To me, a coach isn't I will make you change. It's I'm going to embody the principles of change, and get in rapport with you and try to bring you along. And you can come if you want, and you don't have to. But this is the way we do it. And so to me, that's a successful session, and that's something that's in my control every session. That's why it's a better criteria than we got the change, because we got the change is not in my control.
No, 100% not. Yeah, no, I guess I was just speaking more towards, like, even when you have, great sessions, that's all good. We were talking about when that relationship becomes friendship. And while I think that rapport is definitely important, and compassion and empathy is absolutely important, the point being is that if that box is being checked, right, then, that's like you're paying for a friend, for the client. And that can be expensive because, especially if it's not covered. And then, what I was experiencing was I was having these great transformations. I was feeling great, right? So it wasn't necessarily burnout, but then my desire, right? But the one thing was where I was feeling down was not because I was burning out, but because of the nature of the relationship where I'm the coach, right? Then my hair is not down.
Exactly.
Right. I mean, performance.
You share a little bit about yourself, but you're not sharing your problems,
exactly. I'm like, I want to vent to someone, right?
I want to complain. I know. The coaching role brings out the best in me in a lot of ways, but it's also not all of me, because I whine and complain and feel miserable too, but not when I'm coaching somebody.
Of course, right? Yeah. So as we're coming up on the hour, I wanted to pivot to coaching, and so the differentiator, I guess, really more for David, or at least how I've been introduced, right? Because even for me, like, for the longest time, I I interchanged these words, coaching and NLP or change work, because all I really knew was change work. And so I thought change work was coaching and coaching is change work. And then I started seeing all these coaches who are actually not doing change work. And I can speak about it more articulately now, right? But back then, I just knew that I was being triggered because I didn't know why, right? Because, one, I'm like, okay, well, what are you actually doing? Right? Because like I've gone to some websites, or they'll say even like some of these coaching, schools, right? Are like coaching is basically just asking the person questions. And while I think even in NLP, there is an aspect of language patterns where you can reframe but we're still like changing things even with that reframe and the purpose behind asking a question is often to invite them into a different perspective. Like it is very can I use the word manipulative, but in a good way, right? Like it has an intention behind it. There's an action to it, right? Whereas just simply asking the question, like, well, what do you think you should do? To me, like you can sense the emotion starting to come out, right? It's like, well, if I knew what to do, why would I be paying $300 for whatever that person might be charging?
Yeah.
Right. And so there's a value in that, but this is the thing where I think coaching is like maybe might be motivation, might be inspiration, might be that it might be asking good questions. Although my position, and I'm gonna piss people off, I don't think coaching in and of itself is sufficient without change work. Just like how I feel therapy without change work is not, sufficient as well. But that's
it's good. It's a passionate rant we've got behind.
Thank you. It's a hard.
There's definitely a lot of different coaching schools. There's like, I haven't been trained in any of them, but I've met people who are coaches in other coaching schools. I think there's actually more overlap than you think between a lot of the deeper coaching trainings, which, like sometimes like 100, 200 hours. They're like long. And then there's like all these additional things you can learn later. I think there's actually more overlap between coaching and NLP than you might think. But often there isn't the actual, here's the step-by-step technique that we're going to do now. Although someone who gets a coaching certification ends up learning lots of other stuff. I think that's really common.
Yeah.
But what I'd say from my understanding of coaching, asking questions is a big part of it because the idea is getting away from advice giving. Like that would be more like consulting. Like if you hire a consultant to come into a business, they might tell you like, well, my advice is you do this, right? You're hiring an expert, a subject matter expert. Whereas a coach is more like drawing out your own wisdom. And again, we do that in hypnosis and NLP as well. So like, can you draw out the resources or wisdom in the individual in front of you and have them come up with their own insights rather than you giving them the insight and being the genius and expert and so on. So I do think that's an improvement over advice giving, is asking good questions. And I agree, there's something to the specifics of change work. Like now we're going to go for this outcome. But coaching is often like figuring out what your outcome is. That's what I'd say. Like helping people clarify their goals or clarify their outcome. So like the well-formed outcome kind of process in NLP, I'd call that coaching. I call what I do coaching, period.
My whole brand is Coach the Mind, right? So,
right. And there's, there is this element that's, I think you're making a good distinction that change work might go a little further than some coaching models. Although I think coaching tends to be more change oriented than therapy. Although the original intentions of most therapies, I think, are oriented towards change. They just
of course, yeah. Personally, I think where it always what gets in the way is it's greed and bureaucracy and red tape and stuff like that. I think if physicians were the bosses of the pharmaceuticals, we would have amazing drugs and a lot less prescribing of drugs, right?
Yeah, it's a whole systemic design that bogs people down. It's not personal. But yeah, coaching tends to be outside the system a little bit more. So I think there is a lot more creativity and a lot more, but that can also be good and bad. Like, there's a lot of coaches who are
like I kind of think like advice giving. I can see how it's bad, but I also like in my sessions. I mean, people are coming to me because they want me to give them, okay, well, now that I've uncovered the structure of your problem, this is what you should do.
Yeah, guidance or leadership.
Yes, right. And I'll call that mentorship, right? But
sure. Whereas advice giving, I think the distinction I'd make is advice giving would be like, you should do this exact specific thing, which you can also do that as a coach or a therapist. But when I do that, I frame it as like, here's an idea. You could try this or not. You could experiment with this, throw this out.
Yeah.
Have you tried this? Because sometimes if you ask the client and you actually really tap into a wise part of them, they'll come up with something you never think of in a million years. Happens so often.
I think that's important because two thoughts came to mind. One is if you're going to ask important questions, it's nice to be able to do something with those answers as opposed to just like, what do you think? And they tell you something like, okay,
that's it.
And you do nothing like that doesn't help me.
That's the thing. It's good, but we need to go all the way.
Yeah. So do something.
And what do you think is not a great coaching question necessarily? I think to be fair to coaching programs, I think they're trying to get these powerful, life-changing questions. I hear that a lot in coaching circles.
I think it pays to be able to elicit some great result and then do something with it. And that's where I think like certain principles, not necessarily a technique, just like being able to like elicit something useful, then attach that to something or do something with that answer, not just like, oh, okay, what do you think you should do with that? Oh, I don't know. All right, good talk. Like, well, no, like, but the other thing that I think is useful, kind of on the inverse flip side of that is you can ask those questions. Are you asking the conscious mind or the unconscious mind? And I think this is, I think I'm being Ericksonian, if I can give myself that arrogant little level of pat in the back or something. But if you ask that, are you expect them to like consciously say, oh, I should tell my boss that I don't deserve to be treated like crap, or are you trying to get their unconscious mind to start to process things so that it comes up with something? I think that's a viable course, but I think it helps to do that with some strategy. And I think
and that's the thing, right? And so like to your point, Duff, like I think a 200-hour coaching program, they must be teaching change work principles, right? And so while we on the surface might be asking very similar questions, but we're first getting them to change state to, as you said, the part of them that has some wisdom, right? And that's where I think like David, I think that's the point that I'm understanding from you as well. Yeah,
this actually reminds me of a funny client session I had.
The nuance.
This reminds me of a funny client session I had where I literally asked the client, what do you think, what should you do in this situation? They're like, I don't know. Put them into trance, led them through this whole thing where they met their future wise self and asked them basically the same question and asked these other mentors and other people the same question, brought them out of trance, asked them the same thing. Well, what should you do? Oh, I know now.
Yeah.
They all said the same thing.
Yeah.
So conscious mind had no idea, but unconscious knew exactly what to do.
But you had a strategy. Like there's a plan, and it wasn't just asking questions, hoping they come up with gold. It was like, priming their unconscious to do something with it. And so I think that's different. It's not just like asking questions and like, hope this works. It's doing things to elicit something unconsciously that they can then use either now or maybe even prime them to like create something or to try things out and see what works. Yeah. So those are different sort of approaches, I think.
Yeah, definitely. But I think a lot of what people are learning in coaching programs are, they're maybe not getting quite as deep into the unconscious unless they're taking a coaching program from someone who does hypnosis or neurolinguistic programming. But I think a lot of what they're doing is actually clarifying outcomes, challenging limiting beliefs, like a lot of stuff we do in NLP as well. And I do a lot of that sort of upfront before I do the Maybe
Like
more
for me,
formal
that's the
stuff.
intake. Like that's
Yeah,
the
sort
thing
of
for
an
me.
intake.
Yeah. Like, sorry to like. I know I want you to
Yeah.
finish, but
Go ahead.
yeah, it's like for me, like for all us, I guess that's the intake. And now we're going to do the sessions, and this is what triggers me because to me, it's like you've got coaching certifications. Like a 20-hour recording program that's going to tell you that you're certified now, right? To take on real people. And all you're really being taught how to do is an intake and nothing else.
Yeah. Well, I consider it all coaching in a way. And, the intake is also loosening things up. It's gathering information, but it's also loosening up perspectives and challenging beliefs and giving other points of view and humor and like all this kind of stuff can fit into that. I think that's valuable in itself. And sometimes, you ask the conscious mind what you do, and they go, "Oh, fucking no."
Yeah, who knows?
But then you put them into trance and ask your higher self or your future self who's beyond the problem. They're like, "Oh, I know instantly." So it's helpful to have these kinds of techniques because otherwise, you'd run into a brick wall at some point, which is conscious mind coaching. I don't think conscious mind's bad. I think it's an ally as well that we can bring along. Ideally, we get everything working together.
Yeah, but if they could just do it consciously, they wouldn't need us. I mean, I
They've
think
probably already done it. Yeah, exactly.
Yeah.
Of course, they probably don't have a single friend who will listen to them and ask them a good question, though.
Well, that's a lot. Yeah, you know what? So many of my clients, you ask
worth $100 right there.
Yeah, what do you want? Right? And
nobody's ever asked them.
Yeah,
right?
so I was like, wow.
Sometimes it's really basic, and sometimes
yeah,
more advanced.
Okay.
Well, maybe it's a good place to wrap up.
Yeah.
Yes.
All right, thanks to the listener who has made it this far.
Listeners.
High five. The listener, the single listener has made it this far. We appreciate you. We love you.
Yes, please comment.
Please comment.
Yeah.
Like, subscribe, smash that notification button, and we'll see you in the next episode. All right.
All right, and we're out.